decrease the lumen of this particular plaque, if incrementally to one of these events that can either be terminal and result in death or can lead to severe morbidity and mortality. As we continue our discussion on the damages to the arteries of the body in terms of hypertension, diabetes, cigarette smoking, etc., let us not forget it's not only the heart attacks that we're worried for and the strokes that we're worried for, because the same process that occurs within the brain and within the heart itself, the coronary arteries of the brain and the blood supply, the coronary arteries of the heart and the blood supply to the brain, it's the same physiological process is going to be occurring in other parts of the body. Albeit it may not give us the damages that a heart attack will cause to our flabby heart, the fact that our ejection fraction decreases, or what it does to the brain when we get our strokes, etc., when we cannot actually have any increase in neurologic deficit, and we wish we are prudent enough to control our blood pressure, manage our cholesterol effectively with our physician advice, and basically our own modification of our habits, like discontinuing smoking, discontinuing amount of alcohol we take, discontinuing the amount of carbohydrates we eat, increasing amount of exercise, and trying to be the ideal weight for our height. But when we think about the whole spectrum of it, sometimes it is important to know a little bit more of what takes place at a molecular level. And here again, I'll try and explain in terms of the cholesterol aspect of it. Knowing fully well, we all know by now what cholesterol is and how damaging it could be if the levels are high. We also realize already that when the LDL, or the bad form of cholesterol, is high, it increases the risk factors or damages to the endothelial lining of the blood vessel, increasing the damage to the endothelial wall that allows the migration of things like macrophages, cause the smooth muscle of the blood vessel to undergo hypertrophy, increase collagen formation, and it causes increased platelet stickiness to it that increases the formation of this angry looking thing that, if you just imagine this is occurring in your coronary arteries, it makes us realize how important it is for us to avoid this formation of something like that. But imagine it's the same thing that's happening in the blood vessels of the leg itself. That's why our elderly patients come to us and say, I'm feeling it. The leg is getting painful at night. It feels as if it's on fire. I cannot sleep because it wakes me up at night. In order for me to be able to sleep, sometimes I have to sit up to sleep, and I hang my legs over the side of the bed. This is all part of peripheral vascular disease, which is basically the decrease in blood circulation to the legs itself, and it tends to occur in those portions of the leg in which there's very little smooth muscle. The anterior aspect of the shin bone itself and the rest of the leg feels as if it's on fire. We also will find the same thing that occurs in the hand. We get Raynaud's phenomenon. We also get this increased discoloration of the hand itself. Because of the decreased blood supply, we also lose sensation to the peripheries, where the diabetic, because of the decreased blood supply, also the ones with high cholesterol, that actually cause the decrease in blood supply to the area, will now start to feel numbness, because the blood vessel, remember, the nerve supply and the blood supply are linked together. So basically anything that decreases the blood supply will make the nerve endings to that particular portion less viable, being less function in it, and basically we start to feel the numbness in the hands and the legs itself. It's for the same reason we start to experience erectile dysfunction at a younger age. It's also the same reason we start to experience gastroparesis in terms of enlargement of the stomach itself and unable to digest our foods. So to imagine that the whole thing, just imagine if you understand that you need to control it, you will benefit from all the studies that have been done as to what the damages to the rest of the body is caused. But trust me in saying, the important thing is just to understand that you need to be in close collaboration with your physician and the rest of your family in making sure these things are well controlled. just to talk a little bit about the high cholesterol, because most of us now know that cholesterol is bad and is damaging. It is also, most of us will know that the LDL is the one that causes the damage. The HDL is the good one that protects us. If we have high levels of HDL from exercise and from dieting, we will be able to get rid of some of the bad cholesterol or the total cholesterol, as we can see in this diagram. The LDL is the bad form of cholesterol that is being produced by the liver or from dietary means. And the sad thing for our community is most of us who suffer with high cholesterol would have an abnormally disproportionate higher level of LDL than most populations I've seen elsewhere in the United States that I practice in. That LDL, which is a bad form of cholesterol, destroys the endothelial lining, now migrates into the wall of the blood vessel and causes it to become narrow. That narrowness will now occlude the blood supply to that area. Can also be a reason as to why clots propagate from here as they break off. But the LDL itself damages the entire blood wall, and this is happening throughout the body. But we tend to see it more in the heart and in the brain, because those are where we get the effects when everybody get excited with a heart attack and a stroke. In addition to that, since the LDL causes the blood vessels to stick to the blood vessels, it causes an increased stickiness for things like macrophages and platelets and form a buildup of a plaque. And that plaque is damaging because of the local obstruction and also the propagation of that clot. The HDL, or the good form of cholesterol, tends to take the total cholesterol and help with it being processed in the liver and excreting the fats into the gut itself, and the HDL recirculates into the system. A lot of times we ignore the role of triglyceride. And a lot of times I know in our population, the two major causes of increased triglyceride is the alcoholism and the increased amount of carbohydrates. But this same triglyceride, which a lot of times are not being treated, is actually what caused the LDL particles, this same particle, to become much smaller. The smaller it gets, the more damage it can do, because that's when it can actually migrate even faster into the endothelial wall. So it's very important for us to also control our triglyceride, because in controlling it, we allow the LDL to be the bad particles to be bigger than usual, and it's easier to trap. If we cause those same particles to become smaller, they become increasingly more dangerous to the endothelial linings of the blood vessel. We also have another apoprotein which attaches to the LDL, which causes an obstruction, and that in itself is also an increased risk factor for coronary events and cerebrovascular accidents. So it's very important for us to understand that controlling our cholesterol is absolutely important at all levels, not only just to know that food affects it, but knowing fully well what those levels are, so you can do the same thing that you've done in the past when you lowered it to such an extent where you're actually protecting yourself from further damage. But knowing fully well, if we learn about it at an earlier age, then we can prevent the formation of these plaques. Because once these plaques are formed, it is very, very difficult for the plaques to shrink in size. So whatever investment you place in your body at this time, the earlier it's done, the better it is for you. The more vigorous your approach in trying to control it, the cholesterol, the high blood pressure, the more you will benefit from it in later life. It is so important for all of us to understand it is not to wait until we get a cardiac event or a stroke before we start to realize that what are the things we can do or cannot do. We should at least understand what the disease process is, understand what the elevated blood pressure and high cholesterol does to you, and try and prevent it at all costs. We are still the guardians of our very organs. The issue about that, it's important for us to educate those of us who are not aware of what the damages are, so they can actually advise their physician that they are very serious in taking care of the high blood pressure, the high cholesterol, controlling their diet, increasing the amount of exercise, and do anything and everything that's possible to decrease these disease processes that are almost endemic in our community at this stage.